Today I'm going to present to you about rheumatoid arthritis. Rheumatoid arthritis, or RA for short, is an autoimmune disease, meaning that the body's natural defenses don't differentiate between pathogens and the body's own cells. Let me elaborate more. So, in a healthy human, the immune system detects bacteria and viruses, then sends cells and chemicals to fight them. But with RA, the immune system doesn't function properly, and as a result, it ends up mistakenly attacking healthy tissues, which causes inflammation. This inflammation process affects the synovium, which is a tissue that lines the insides of the joints and produces synovial fluid that lubricates, cleans, and helps joints move smoothly. And the inflammation causes it to thicken, making the joint swollen and painful. And if that keeps going untreated, then it would damage the cartilage that covers the ends of bones as well as the bones themselves, which will cause it to lose its shock absorption function as it gets thinner and the space between the bones becomes smaller. That would make the joints lose their mobility, become stiff, unstable, and even deformed. Unfortunately, rheumatoid arthritis does not stop at the joints only, but also affects body systems as a whole, like the cardiovascular and respiratory systems, which earned it the title systemic disease. Of the current world population, an estimate of 1% suffer from rheumatoid arthritis, and that means that it's a rare disease. This 1% roughly amounts to 70 million people around the globe. Interestingly enough, it was found that RA is 2 times more likely to appear in women than men, and that is said to be because females generally have a more reactive immune system. People with RA experience pain, fatigue, loss of appetite, as well as low-grade fever, not to mention its effect on the cardiovascular system, which includes heart attacks, strokes, anemia, and blood vessel inflammation, which can lead to nerve, skin, and organ damage. Its effects on the eyes can lead to dryness, pain, redness, sensitivity to light, and even impaired vision. While it's limited to dryness, gum irritation, and infection for the mouth. As for the lungs, RA can cause inflammation and scarring, which leads to shortness of breath. Rheumatoid arthritis can also cause rheumatoid nodules, which are small lumps under the skin over ebony areas. When diagnosing a person with rheumatoid arthritis, many procedures must be taken before confirming a case. Any physician would know to ask for family history with the disease because it could have happened due to an inherited mutation. Then a general physical checkup should be conducted, where the doctor examines the joints to look for any tenderness, swelling, and painful or limited movement. Other physical checkups include imaging tests such as X-rays, ultrasound, and magnetic resonance imaging, also known as MIR. MIR especially can detect any inflammation in the joint, even if no damage is present. Some blood tests are also required, which split into two categories. The first one being inflammation markers, like erythrocyte sedimentation rate, also known as ESR or sed rate, and C-reactive protein, CRP. The second type of tests are to detect antibodies such as rheumatoid factor, RF, and anticyclic citrullinated peptide, or anti-CCP for short, the latter being a very strong indicator of the disease. But there is a slight problem concerning these two tests. That is, for RF, only 80% with rheumatoid arthritis um, possessors hold this antibody, while for anti-CCP, it is only 60 to 70%, which can be quite troublesome for those 20 to 30% of patients that don't have it. People who suffer from rheumatoid arthritis face many challenges every day, like movement. It becomes very difficult as the joints curl inwards more and more to eventually become fixed at advanced stages of the disease, and that would stand in the way of even the simplest activities. They also struggle with all the side effects of the disease itself, like osteoporosis, which is the weakening of bones, as well as its toll on the nervous system that drives them to be very sensitive individuals. Not to mention all the other effects of RA that I have mentioned earlier. All of this needs many drugs to keep under control, but many of those drugs have side effects of their own that need other drugs to take care of it. So that's another issue that makes things harder for RA patients, especially since those medications are not temporary but for life. Which brings me to the effect of all this on the mental health of patients. They end up with extreme anxiety and depression and can't stand to see themselves in a situation like this, especially when they see how their joints become disfigured and how they can't perform everyday activities as they please. They even get bored of all the constant drugs and attempt to stop taking them. Checkups become embarrassing and even painful at times because of all the movement required, not to mention that they have to frequently go for them every 3 to 6 months so their doctor can track their case. So, to reach remission, meaning minimal or no sign of disease, the patient needs a variety of treatments that have to be physical, mental, and oral as well. And the goal of the treatment is to stop inflammation, relieve symptoms, prevent joint and organ damage, and maintain the overall well-being of the patient as well as reduce long-term complications. So, the first type of treatment is physical treatment, and it's perhaps the most important of all three kinds of treatments and has many applications. It starts with a massage to relax the muscles and the body as a whole to prepare it for further treatment. The next step would be acupuncture, which are little needles that are pinned to certain spots in muscles called pressure points. Despite how threatening it looks, they actually help relax the muscles while strengthening them at the same time. Then comes exercise, which in this case is movements of the joints. So they would get used to moving and to also strengthen the muscles around them, which helps in keeping the shape of joints. Ozone, O3, is also used in treatment of rheumatoid arthritis. due to its healing abilities. It gets injected as a gas in muscles, which not only speeds up the recovery of cells, but also floods the body with oxygen, which is very beneficial. The last line of physical treatment would be plasma injections. Blood would be drawn from the patient and then goes through a process to separate red blood cells from the fluid it swims in, which is the plasma. Then the plasma of the patient is injected directly into their joints to help replace the worn out cartilage. There are two types of medications that are used to treat rheumatoid arthritis. One, drugs that relieve symptoms, such as nonsteroidal anti-inflammatory drugs, also known as NSAIDs, which reduce joint pain and swelling. Examples of them would be aspirin, ibuprofen, naproxen sodium, and they can be taken either orally or applied like a cream. Next are analgesics, which are used for pain relief, and there's only acetaminophen, which is taken orally. There are also glucocorticoids that are called steroids or corticosteroids. They work on reducing inflammation, such as prednisone and methylprednisolone, and they can be taken orally or by injecting them in a muscle or directly to the joint. The second type of drugs would be drugs that control disease activity, and they include the early aggressive treatment of RA, with a category of drugs called disease-modifying antirheumatic drugs, or DMARDs. Those help reduce disease activity and slow down its progress. They include conventional synthetic DMARDs that have a broad immune suppressing effect, like methotrexate, azathioprine, hydroxychloroquine, leflunomide, and sulfasalazine. There are also biological DMARDs, also called biologics, and they target specific proteins or block blood cells that help release inflammatory proteins, such as abatacept, humira, anakinra, and cimzia. Lastly, we have targeted synthetic DMARDs that affect different inflammatory pathways from biological DMARDs, like Xeljanz and Olumiant. So an important part of rheumatoid arthritis treatment is, of course, mental health treatment, as patients end up with depression and anxiety or some other kind of disorder, which would cause the disease to become more active. And thus, they need to see a therapist regularly in order for their mental health not to deteriorate. But that can also be dealt with by family and friends of the patient, to listen to them, to not make them feel like they can't do anything, to not point out anything about how they look, and to will them on. Then comes the role of the patient themselves, not to overexert themselves, to rest, to reward themselves, and not to give up. Thank you for listening.